about the mental disorders. The mental disorders affect more than 300 million people in the world. Mood disorders are part of, they have as main characteristic a mood alteration. It has been documented that factors typical of the scenarios where people spend much of their time, such as a workplace. They can impact the mental health of human beings. Among working population, health workers are those that present more mental illness. That mental illness the is for World Health Organization a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. For Colombia, it is documented in Law 1616 of 2013, being an essential component of the well-being and improvement of people's quality of life. It is considered a fundamental right and a priority public health issue. In this case, mental disorders in 2013 is reporting an increase in mental disorder for the World Health Organization, and it stated that more than 300 million people in the world suffer from depression, and around 260 million have anxiety disorder. In 2019, 1 in every 8 people, or 970 million people around the world, were living with a mental disorder, with anxiety and depressive disorder. But in 2020, the number of people living with anxiety and depressive disorder rose significantly because of COVID-19 pandemic. Initial estimates show 26% and 28% increase respectively for anxiety and major depressive disorder in just 1 year. This investigation was in 2011, but I decided to did a historical change. Mental disorders in Colombia, it's estimated that 8 of 20 people have suffered for a disorder of this time. According to data from National Administrative Department, the day between 2005 and 2015, in Colombia, there were 2,154 deaths associated with mental and behavioral disorders, and excessive compulsions of cigarettes, alcohol, and cannabinoid type psychoactive substance was present in 16%, 22%, and 8% of those suffering respectively. The mental disorder has other classification called mood disorder. This mood disorder is presented when a person or people has a person has a mood disturbance, a prolonged sadness, a suicidal ideation of attempt, an indifference, pessimism, prolonged weakness without over fatigue, chasing the appetite, and chasing in sleep pattern. And these mood disorders are classified in different kind of illness. For example, depressive disorder, bipolar disorder, substance-related disorders, and disordered sleep-wake disorders. Disorders related to trauma and stressor, and anxiety disorders. This development that triggers or risk factor, for example, the job, when you spend most of your life and some situation, for example, work overload, low wage employment, lack of clarity in functional position, contracts uncertainty about the future or work, poor resources, lack of autonomy and decision making, and globalization contributes to these stress and this risk factor increase. In Colombia, the RLM or Administrator Rigs talk about or report about the anxiety and depression are the third causes to consult for occasion that accidents laboral. The object of this investigation is to correct safe mood disorder in healthcare. Workers belong to a third level health institution of Colombia. The type of study is descriptive study, and the study population was healthcare workers were performing their labor at the institution and who had a mood disorder. They were referred to a psychiatric consultants. The criteria of the eligibility having presented a more disordered, constant crying during the workday, lack of motivation, apparent sadness, angst, suicidal attempts, and irritability. That disturbed their work and personal activities. And the college information was a secondary sources of information was used where socio-demographic, occupational, and mood disorder data recorded that clinical history. A sample size was made for companies who, after being identified by the department head, received an explanation of the initiative and were invited to take part here. Those who expressed interest in accessing this type of help were referred to a psychiatric consultation. In order to control information bases, only one psychiatric performing the consultation. The tool used to consolidate the information was designed and standardized by a study personnel. This is a result of this investigation. In number one is a socio-demographic and work performance characteristic of her workers. These were 48 health care providers were part of the study who work as a professional nurse. This is 8.3%, and nursing assessed is 81.3%, and ordinators that were the 10.4%. With the exception of two ordinators, the study population was women and LDs. 75% of them were under 47 years of age. In the second table, you can see the psychiatric characterization of the study population. The difficult family and personal situations such as death of loved ones, separation, sexual assaults, and illness were grouped as symptoms derived from traumatic situation and were present in 20.5% of nursing assistants and 25% of professional nurses. Conditions such insomnia and suicide attempts were reported by 66.7% and 28.2% of nursing assistants respectively. The other result is more disorder identifying the study population. In this graphic, in this study population, it was found the among nursing assistants, severe depression without psychotic symptoms was the most frequent diagnosis. 48.7%. The other hand, adjustment disorder were the most diagnosed in the stressors behaviors groups, 60%. The other classification of mood disorder according DSM-5 diagnostic criteria a reference guide because it was in the past. When classified the mood disorder reported for the study population, it was found that depressive disorder for the most frequent for nursing staff, 50% in professional nursing and 71.7% in nursing assist. Regarding the group of stressor bearers, disorders related to trauma and stress factors were present in 80% of this group. In the discourse, we found a different result. For example, the depression, the prevalence of 50% professional and 74.4% nursing assist, and finding that agrees with that is reported in the literature of the subject. When the mental health of nursing personnel has been characterized, work stress and anxiety are also part of this group. The other result is the service where a nurse was working because the emergencies it was a condition was present at least 47.7% of nursing staff. Studies have shown that the stressful environment, work overload, and labor demand of emergency service, and the pressure of care that is experienced with them, favor the appearance of a state disordered mood. And the next result or that found in this discourse was the insomnia. Kojama confirmed that it is the nursing staff who have the highest level of insomnia compared to the rest of the team of health workers, reporting a prevalence of 20%. Measures focuses on caring for the mental health of the staff were adopted, encouraging life skills that positively impact aspects as attention and stress management, self-awareness, and problem and conflict resolution. Those caregivers who presented a mood disorder were evaluated by a psychologist who determined the appropriateness of support from the psychiatric professional. The institution decided to provide a support through a lawyer for those workers who had problems related to legal matters. In conclusion, with the mood disorder, those related to depression were found more frequently in healthcare providers. The condition of the work carried out by them may constitute risk factor for mental health in this population. Institutional initiatives such as one presented in this study make it possible to characterize the problem and develop the strategies focuses on the specific problem, positively impacting the mental health of the population. Thank you.
Okay, thank you so much for the presentation.